today, Tangram has came up with this idea that we need to make sure that people, especially parents and teachers, are updated with the techniques and strategies when they deal with children with special needs. Tangram is a human development center and we cater a lot of psychological services. But more importantly, we also specialize in diagnosing and testing for neurodevelopmental disorders of children and adolescents. We also take in extensive case history of children as well. Today with us, we have this brilliant panel of speakers who are very much expert and have a lot of years of experience dealing with children with special needs. Starting off with, we have Ms. Mala Arora. She is an education consultant working in the field of inclusion, diversity and mental health in UK and India. She has been a recipient of prestigious Jack Petchey Outstanding Leader Award from UK for her service to the young people. She is a recognized British Council teacher and a special educational needs professional from RCI India. We also have Dr. Griva Shah. She is the founder member of Pearl Special Needs Foundation. Pearl is an institute which has been working since the past 11 years and catering to the holistic development of people with special needs. They cater to individuals from the age 3 to 40. She is also a special educator and has done her qualifications from London, and she is a practitioner. And lastly, we have Dr. Nimrat Singh. She is the founder of Tangram and has played a pioneering role in developing the first counseling center in India. She is an international psychotherapist with more than 25 years of experience and is a passionate promoter of supporting people who have special needs. So without any further ado, let me start off with our questions for the panelists. Starting with Dr. Nimrat, I wanted to know that how do we recognize that a child has special needs requirement?
Good evening, everybody. And thanks so much, Jayati, for this lovely introduction. Yes, today is a very important topic and a topic I think close to a lot of people's hearts, though we don't talk very easily and openly about it, but I think we would love to use this as an opportunity to talk about something which is every child is so special and dear, and every child is born unique and distinct and different, and many times we forget that because we think children have to fit into a particular type. So to answer your question, when a child is born, the very fact that a child is born, the child comes out with a birth cry. And that is a very important determinant of whether the child is born healthy. Then if you look at the first few weeks, the child starts recognizing the mother. There's a social smile. So the child starts, if somebody is moving around the child's eyes gaze around, and it's such a happy moment for everybody in the house. Then there are moments where the child shifts gaze or shifts the self. In 3 months, the child starts turning around, 4 months. And then the crawling and the milestones begin. Now, this is almost like usual and normal. But if a child does not show any social recognition or does not show any gross motor skills to start with, is not able to play with toys or handle toys at the age of 4 months or 6 months. See, also remember that it is plus a month or two. In the initial times, it's not necessary. Like for some children who don't talk till the age of 2, it's not abnormal as long as they are babbling. So there are pediatricians, there are clinical psychologists who take an entire understanding. So this is all recorded. It's very scientific. The whole thing of, how history is taken, so that before birth, at time of birth and after birth, yeah, there are some red flags which we need to look at. Is the child responding? Sometimes there could be a physical deformity or dysfunctionality. The child may not be able to see properly. So there could be comorbidities or cannot listen clearly. So these could be some things, and very early, if this gets detected, it is easier. Then there could be social communication, response to people around, to toys. All these things would, give us some idea. And it is later that we look at, things like specific learning disability, or we could look at ADHD, which could also be a dysfunctionality where the child is not able to focus, may have a lot of restlessness, inner restlessness. In autism, the child may not respond and communicate socially, may behave in a way and keep doing something in a particular way. So all these things would become red flags. And that's where the role of pediatricians, doctors, psychiatrists, and clinical psychologists, child psychologists come in.
Thank you, ma'am. That was actually that was the first step towards the session that we're having today. My next question is to Dr. Griva. Can you share some tricks, some techniques or strategies that the parents and teachers can today take away when they deal and when they groom children with special needs, so that they can have a better lifestyle ahead?
Right. Thank you, Jayati. Yes, there are multiple strategies. And I think as a teacher, one of the most powerful strategy that I have used in my career of around 19-20 years, and even at Pearl, is we call it WACT. WACT means visual, auditory, kinesthetic, and tactile method. This is very ingrained in the whole model of Pearl. And we use it consistently to develop. It could be academic skills, it could be socio-emotional skills, it could be pre-vocational skills. So this is one of the trend. Sorry, no, it's not for me. Okay, so yeah, that we consistently use at our institute. Moreover, there are a lot of practical things. See, this is one way where the bookish knowledge stands. Another way ahead is also a lot of on-ground learning. Like sometimes when an individual has got special needs, as Nimrat ma'am very rightly said it, it's very unique in the style. So, and also children might have different level of, neurodiversities. Now, this is very important to keep in mind, I think, as parents and teachers, as practitioners, that nothing happens automatic in the field of special needs. An individual needs to be provided an environment or a strategy to achieve it. Like suppose an individual with autism. Now, if you say, as Nimrat ma'am said, they have difficulty in language or eye contact also. So that does not mean that the child is not able to learn, or child does not have an intensity to make friends, or they do not have socio-emotional needs, because they appear, it is like, they're aloof and they don't want to. But the fact is they want to, because they are humans. We all have the same kind of emotions. The expression level differs. So that is where, very on-hand practice also comes there. Like we also need to have a curriculum like turn taking. Turn taking becomes a curriculum which we as such think that, okay, the child will learn, as they age, they will be with people and they will learn. But children with autism find it tremendously difficult to learn the skill of turn taking. Or children with Down syndrome, they might have a great, they are amazing at communicating, or they are very social, but they might be not that comforting around others. They might like to be the boss around, or they might want to be constantly the first around. But then they become also very good at influencing other special needs. So they might need a strategy to how to play cooperatively. So there are some things are academic level, some things are also co-curriculum level, but there is definitely multiple strategies. Few strategies are hands-on. It cannot be always done in the classroom. Some strategies are on the ground. And that is how the whole process keeps on. There are strategies where they can use pictures. Pictures are also one of the very powerful strategies. One we use at Pearl is picture exchange communication system. So it can be used with on a device. It can be in a hard copy form. So even an individual with non-verbal, capacities can also use it to communicate. So yeah, these are the few strategies. There are far more.
Thank you for comprising it for us and making it so effective to deal with. My next question is to Mala ma'am. As an expert in inclusivity, you must be aware that there are a lot of prejudice and discrimination that takes place when we want to, come up with the concept of inclusion. And a lot of children with special needs face that. So how do we deal with this prejudice?
Hi. Thank you, Jyoti. Thank you for the question. Um, let's start with the educational institutions. So the leadership have to understand the fact that the moment child is admitted to their school, they become the guardian of that child for the next 14 years of their school life. And therefore, this brings a responsibility on them to define a roadmap for that child's school journey. The school has to have this clarity from day one that how would this benefit, how this provision, the school would benefit that child. And once they understand that the child has particular needs, they need to then plan on how they would adapt their school, their teachers, their understanding, so that the culture of the school focuses on learning and progress rather than teaching only. So, and while strategizing all of this, they are not leaving any child behind, not excluding any child because of whatever reasons. That's how a school can claim to be inclusive. Another important factor which the school need to be clear about is that special needs teachers, the educators, they do not have a magical wand. And therefore, hiring them doesn't make the school inclusive. So they are a great resource whose services can be used to assist in mainstream classes with mainstream teachers in their planning, in resource making, to understand assessment reports, to assist during therapies, and during the multidisciplinary team meetings. But the onus of all the children in an inclusive setup has to be on the subject teachers and the class teachers. And since we have mentioned teachers here, we would all agree that children value their teachers a lot. And therefore, sometimes even parents do rely on teachers to intervene and sort out their issues. So the same has to be for the child with special needs. As a teacher, it is my responsibility that every child in my class learns and makes progress at their own pace, and no matter how little progress is made. And I cannot say that I'm not equipped to teach certain children or I'm not trained to teach children with special needs. Now, the prejudice attached with the label of special education needs does scare some of the teachers. And to be honest, I have been in those meetings where I have been told by mainstream teachers that, we have worked with this child, but clearly this child is those SEN types. And so, your department should be looking after them. And so I would say that, excuse me, as a subject expert, you are better equipped than I am to know how to differentiate your plan to meet the child's needs. So I would feel embarrassed if I have to say that as a teacher, this child's need cannot be met in my class. Well, that means I lack in planning in my lesson. And teachers must understand that it is not extra work, but it is the work they're supposed to do. They are expected to challenge themselves and push themselves towards being creative and be able to think out of the box, accommodate various needs of these students. And sometimes these prejudices can also unintentionally come in while, in a regular way of working. So like giving feedback during parent-teacher meetings, on one hand, the teacher would be speaking to one parent in the way of a lot of encouragement, like, your child is working at 95%, and we should work together to bring that to 98%. On another hand, the same teacher would be conversing with the child with special needs or the parents of the child, saying that, oh, I must tell you how the challenges, what are the challenges we have to face with your child. And he cannot do this, he cannot do that. And, he would fail if you do not support him with extra tuitions at home. And actually, best would be that you take your child to another school. This is very often we hear from the mainstream teachers. So our strategy or our take on that is that why can't this change to that your child is working at 20%. And if we work together, we can progress to 25% because that is where the child's baseline is. And we can maybe push that child, train that child and bring it to a certain level. And now this also can only happen if a teacher is aware of the child, has made that effort to know the child, and is already putting 100% in that child. As a teacher, I know where the child would struggle. So why would I have the same benchmark or cutoff for this child? Especially when the boards, be it CBSE, IGCSE, IB, or state boards, are extremely flexible with the curriculum and provide special considerations when it comes to board exams, like 25% extra time, laptop or word processor, individual room if the child is on autistic spectrum, who cannot cope with too many people in the same room. So there are numerous relaxation that the boards offer. And the school has to just make sure that they start using these relaxation at very early age so the child get used to that system of learning. And so when they're giving exam, it should not come as a shock that, oh, now I have to do it on the laptop. And again, when we talk about prejudices and dealing with it, it's very important to mention about parents. Certain parents do get stressed out to see that their child is not performing at par with the peer group. And this can bother them to an extent where they take all the paranoia on the child. And even worse, when the siblings are compared. That does have a lifelong impact on their relationship as well. So parents have to understand that every child is unique and my child may not be able to perform the same way as their peer or, that uncle's son or that auntie's granddaughter. And therefore, I need to understand their interests and their rights to be able to clear my confusion for this journey. And this has to be along with the school. There has to be a partnership there. Every parent would raise voice when it comes to getting best for their child. So parents with children with special needs are no different. So yes, the battles may be of different sorts, and for that they need to be aware of their own child, their strengths, interests, and capabilities. So the parents have to understand the diagnosis and the condition of their child and how the school could help their child in there. They need to be able to ask questions from psychologists, multiple professionals working with their child, the school, teachers. They have to talk to the other parents and most importantly, have conversations with their own child, believe in their child and know their abilities. So parents must have also clarity that the school is not doing any favor on them by admitting their child. It's their child's right to be in that school and the school has to prepare for their child. Thanks.
Thank you so much, ma'am. I think that opened a lot of people's eyes as well. So before I move forward with the next set of questions, I would like to open the floor for the audiences if they want to ask any questions to the experts. You can drop them on the chat box, and if you're comfortable, you can unmute yourself and also ask. I think I'll continue with the questions. If we get any, I'll include them in the set. My next question is to Nimrat ma'am, that what are the mental health issues and some psychological disorders that children with special need face, and how can they cope with it?
Brilliant. I think this is what is going to follow from what I heard Mala saying, that though, in our minds, we think that, we need to include them, but we do exclude them. It is almost natural for us to want a perfect child. And if the child doesn't fit into that, that also includes schools. Schools also looking for children who follow, who do things the way they ought to be done. So obviously these children have a lot of issues. They face a lot of issues. There are a lot of comparisons. So from a very young age, the child starts feeling, if I use transactional analysis language, I'm not okay, you're okay. So the world around me has to tug me around, lag me along, and their dependency increases. And somewhere when the parents thrive on that and they do not help them to struggle with whatever difficulties they have. So this is one thing. Then it also causes a lot of sibling rivalry and the child starts feeling more inadequate. If the child is an older child and has special needs, a younger child comes along, or the other way, that this child needs more attention from the parents, so the other siblings tend to get jealous that mother's spending more time. Many times the fathers in a way are dismissive, or grandparents feel that this is like a curse that's come to our house. I'll honestly tell you, these things I've heard, so I'm just talking from my experience. They really want to live in a world of fantasy. They don't want to believe that this child has some limitations. All these things add, then they also get bullied in school. They also get, Jayati, just mute that person up, na? They also, sometimes they get bullied. Academically, they're not doing very well. Many times socially, they lag. They're not able to communicate. They're not able to move very fast. they're not, they don't play enough sports because maybe, an autistic child or child with attention deficiency or Down syndrome child, a child with attention deficiency would always be breaking rules, so he would never be accepted. Children with dyslexia may not, be able to write and express themselves. So, lot of issues that come along. So there are a lot of behavioral issues if these children are not accepted and handled with compassion. And it always begins at home. Are parents accepting? Do they know what the diagnosis is? Diagnosis is not to be used as a label, but as an understanding that now that we know what the child can do well, what the child can't do well, and within that, how we can make the best. Instead of looking at the glass half empty, can we look at the glass half full? And I personally have met students who have had issues with writing, reading. They've been dyslexics or ADHDs, and I've seen them doing brilliantly well in catering, in creative fields. So if you really map and track these children over a period of time, and if they're given the right kind of education and they're given that respect which they deserve. All of us deserve respect. We need to be understood. I think they really flaw, but they're just different flaws. So I think this is what I think, that they do have issues more because they are not accepted and respected as, as other children would. Yes. So I wish this changes.
Yeah. In lines with it, I also read a study that 33% they are more likely to be mental health issues just because they're not accepted, as you said.
Yes.
There is a question in the chat box that Griva ma'am or Mala ma'am can take up. What is the earliest, how early will we be able to understand whether a child is autistic or not?
Yeah, I think it is right away possible from 2 years on, as Nimrat ji stated, that the symptoms are very, very visible right from the milestones. It can be easily diagnosed because right from the body movement to the eye contact to response to the name, I think it is so visible to identify individuals with autism. And I'm sure the person stating this, you can always now, even if it's Ahmedabad or even around India, if the person, parent are joining, you can always contact your pediatrician or clinical psychologist. And the milestones are the best way to look at the difference. And as Nimratji very rightly said, there could be plus minus 2 months here and there. But the way an individual communicates, if there is rocking involved, flapping involved, lack of eye contact, lack of response to the name of a child, apart from sometimes even they might just respond to the mother or the father, even to the close knit background. Also, the individuals with autism do not give that social smile and that social connection. I think these are all the basic signs that are seen, and I'm sure we, as Jayati would say, there are emails around, and we can also give a basic diagnosis of there are how to identify an individual with autism. That's also, it's a layman level also, one can definitely identify.
Thank you so much, ma'am. Moving forward to Mala ma'am, there are a lot of institutions now trying to open up, trying to mix the two sort of education, special needs as well as the so-called mainstream. So what are the challenges that these institutions face when it comes to inclusivity?
Okay. Well, it is very important to understand that inclusion is not only limited to giving admission to a child with special needs and be nice to them or babysit them. That is not inclusion. I cannot stress enough how important it is the early identification and early intervention for these children. And the interventions put in place during the formative years can go a long way in successful transition to primary schools. And therefore, it is extremely important for the early years educators, early year schools, preschools, to be vigilant and share their observations with the parents and the leadership team. Now, I have come across a couple of schools, preschools, who would rather be dismissive about certain characteristics presented by these students. Now, this is often because they aren't sure about it due to lack of awareness, do not want to confront the parents. And for schools, thus certain parents are seen as unreasonable or too demanding because they're asking too many questions, or maybe they are in that denial phase and they do not want to agree with what the school's observations are. Now, well, that's where the prejudice are formed, and not only towards the parents, but towards that particular child also. So now this child becomes a talking point across the school. In that child's classroom, there is often an assumption that because of special needs, this child will be unable to complete a task or be part of a group activity without assistance at all times. Now, therefore, there are events where the teachers and the peer group would have very low expectation from them and may not even include them in various events. So, well, if the professionals introspect, they will find how unintentionally sometimes they have been passing remarks or commenting on the child's ability out of those prejudices that have developed. And some of these comments or remarks can be really humiliating, especially if said in front of the peer group. The children learn well from each other, and excluding the child from lesson or from an activity doesn't support their learning. So the peer group very well understand that this particular child needs different treatment, and that the children always show, and the teachers always show that their disappointment when it comes to this particular child. So that is what a peer group or teachers have to be very conscious about when we are talking about having a child with special needs in our classroom. And because that's where the peer group would develop those prejudice and try to belittle the child with special needs. And the child with special needs feels that he is not or she is not wanted here or is not part of the class. And we would agree that sometimes children can be nasty, and especially when they learn about certain limitations of particular children or a child. And so to overcome these barriers in an inclusive school, we need to work in collaboration, have a very strong partnership between professionals, parents, and schools. So, for example, often schools ask parents to get psychological assessments done. Now, once the reports come, these reports sit in child's file forever. Well, the reports come with some recommendations, some suggestions, and those are expected to be incorporated in the lessons and in the planning for that child to be able to make progress in that inclusive classroom. That would equip those suggestions, recommendations would equip the teacher to use different strategies which could be used during the lessons to support that child. And that's when we can justify and measure the progress of that child in a mainstream school. Teachers can be great at instilling confidence in students and bringing them together to appreciate differences and diversity. And I'm sure you all can remember that one teacher who was always very nice to the entire class, and as a result, that subject had become your favorite. So many times we hear parents say that my child was doing very well with that particular teacher, and since that teacher has left, the child's progress has completely gone downhill. So lastly, I would say along with the collaboration, I would highly suggest sensitization, which is extremely important for the leadership team to consider. The sensitization of the whole school, including students, parents, school staff, from lunch ladies to the security guards, to every teacher, leadership team themselves. And it is absolutely vital that the whole culture of the school should reflect the school's ethos and their ideology towards inclusion. So it's not done only by the leadership team, but it should be top to bottom.
Thank you so much, ma'am, for that. We do have another question in the chat box where they want to know that what can be the earliest stage where ADHD can be diagnosed, and also focusing on the fact that a child can just be an active child, and then the demarcation that the child is entering into the spectrum of ADHD, how does that happen? Nimratam, can you take this question up?
Sure. In fact, we've been associated to a lot of schools where this was, yeah. So usually what happens is when the moment rigor starts in school, where there's more in terms of routine structure, that happens in grade 1 actually, that's the time, the comparisons start and the child is lacking behind clearly. He has an attention deficiency, or he could be very restless in class. He's not able to sit. So it's more seen more in the as misconduct. And it's in grade 1 and 2 that teachers clearly can make this observation. I normally tell them, I give them an observation sheet that observe the child, and number of teachers need to observe the child also. Sometimes it could also be the child is agitated about something. So it's not a one-time diagnosis, but usually when the child is in grade 1 or 2, very clearly that is seen. Now, the challenge is many times parents are not ready to accept it because they don't think that they can see those things at home. They say, no, to normal hair, that's okay. So then that's where I think what Mala is saying, this collaboration between diagnosis to the school, to the parent, I think where the child becomes a stakeholder, he's a very important person there. And many times it's very unfortunate that people go into medication rather than helping the child otherwise. Now, if the severity is very high, yes, that is the need of the hour, but many times it's not even understood. Like, we don't get it. I think psychoeducation, I would really focus on the psychoeducation, even where teachers are concerned. Many of us don't have the agency. We don't even know. So then that's where the labeling comes and it becomes very cumbersome for the school to handle them. I remember my own son had attention deficiency, and I was called to his school. He was in grade 1, and they said, what, just come and observe him, just sit behind in the class and see. We're finding him a little odd. So for little things, his attention would go to a ant crawling, or he would start looking out. He just could not focus and concentrate. But the good thing is he knew what was happening in class. So that day it was like the mother's positive response, or whatever you may say, that mother effect. He was concentrating and doing well. But over a period, we did realize he has a problem with attention deficiency. So they did something very interesting. They created a space in the class where he could sit like a little sofa, where he could doodle, he could draw, he could express himself in other ways rather than just writing. And he just didn't want to write. So I think within a year, we saw a huge change in him. And even he started using the computer very early. So rather than writing, he was using the computer. So I think if schools and parents, we partner and not look at it as a problem, look at the solution. Here we're looking more at the solution. I think very easily children can overcome these issues. So I hope I've answered your question.
Yes, definitely. My next question is to Dr. Dhruva. What are the future aspects and roles in terms of opportunities and vocational development when we talk about individuals with special needs?
Yeah, thank you, Jayati. Very important question. And there are ample opportunities. Like as so beautifully Nimrat ji stated, the situation of her son and how it was dealt with. So it is like there's always a way out of a situation. See, now special needs, obviously it is a very vast field. We have individuals who are profound, who are moderate, mild, in different capacities of intelligence. But it does not mean that, okay, if an individual has profound needs, means that individual is good for nothing. Or, if the child has got XYZ, autism, Down syndrome, learning disability, means they are not good for employment. Now, the Pearl School and Vocational Center, we have very intensive work readiness skills that we provide, where we focus on the physical, the intellectual, the emotional, and the social aspect of developing an individual. Now, the reason why this is focused, because there are opportunities out there. There are blue collar jobs available where the individual can really fit into an environment to sustain. So irrespective of the type of their special needs or the intensity or the severity of their intelligence, there is a work for everyone out there. There is a very good saying that goes, if I'm able to do one job, and if I'm even useful to one person, it does not mean that I'm useless. I'm just used less. That is how it is. So, and currently in this 11 years of our journey, and yeah, it has been quite frustrating at times, very, very difficult to get, or get a job, or even an opportunity, or even to talk to people. That the journey has been very long, quite frustrating, but yes, we are standing here today with super confidence, and doing work is because there are ways and there are opportunity. Pearl has employed quite successfully around 10 to 12 individuals into the our society, into the blue collar job, and there are individuals who are in training and in work readiness skill. Now lately, Jayati, the difficulty is that sometimes we, because now there are, because of CSR, and a lot of, in currently, if I see 5 years, the society has also become well aware, they are sensitized, and people want to have individuals with special needs or neurodiverse individuals on their panel, on their, to be as their employee. But the difficulty, when we see there are opportunities, children are, we do not have enough individuals who are ready, even after we, even if I have to say rightly, even if we give a 3 years of intensive training, you cannot bridge the gap of 20 years. That is where the struggle currently is, where parents really need to understand that keeping children at home is not an, it's not a good choice. You need to get them into the society, and that's where there are amazing and ample opportunities for vocation. There could be a sheltered employment, there could be an open market employment, there could be parent guided employment. There is so much that can be done, and we have seen, we do so many programs around, and we have seen when children with special needs, they have an environment to be involved, even in an online mode and an offline mode. Their confidence and joy to connect is so different, that itself works as an, being an assertiveness or a readiness towards work. So they need that environment. We cannot replace in 3 years a work of a 15 years of an education system or a training system. They need to be part of the system. We understand there are parents who might say the schools do not accept them, or they are not providing the right kind of a training. We do understand that, but at least from last 10 years, the situations are changing. They need to provide them the right training, the right education to be ready for an employment. So there are so much employment, right from retail marketing, hospitality, data entry, debate making, you name it. They can be into back office work, administration, handling a shop. Along that, there are so many possibilities that along with a neurodiverse individual, there could be a neurotypical individual working together, provided they have been in a part of a training system and they are ready. Then there is so much that is available out for them.
Thank you so much, ma'am. I think the concept of that groundwork that needs to be done these days is so important. Continuing from what Dr. Griva said, I had a question for Mala, ma'am. A lot of times, as ma'am said, that parents need to understand that they need to put their children out in the society. But during the initial stages, early schooling, a lot of parents are very ashamed that their children are diagnosed with special needs. As simple as someone who's not able to cope up in the class has SLD, but that does not say their intelligence is low. They're just learning is slow. So how do we counsel them? How do we deal with parents who are not able to accept their children?
Right. We have seen a lot of time the denial stage in the parents that goes beyond what we would say a decent, couple of years. And it is sad to see that a lot of separation in parents also happens because of that, because there is kind of a blame game happening. The husband would blame the wife for being whatever, and giving birth to a child with special needs. So therefore, there are a lot of factors in here wherein the parents need a proper counseling, and that's why I say the schools are very good at that. Schools play a very important role where they can be supportive. They're not just disclosing their observation, but they are saying that how we can work together. This is a fact. And that's why schools need to have those assessments, those documentation in place, because you can't just turn up after one whole year and say, oh yeah, your child hasn't progressed actually. But so what have you done as a school with that child? When you knew from day one that the child wasn't performing. And it happens a lot with spending 2 years in a preschool, those uh, early years they have spent in 2 years in the school. And after that 2 years, the schools are actually not ready to provide a good report to the primary school so the transition can take place. They do not provide with all the observation or all the data which would help a primary school to help to cater to that child's need. So these are some of the gaps, as Riva ma'am was also saying, that it's the gap in the whole system. Because if we do not pass on the information, if proper handing over has not taken place, then the parents do not have the confidence. They don't want to then have an 8-year-old child and going from pillar to post to find help there. And that's where the confidence and the self-esteem of the parents also fall. That okay, now I have a child who's 8-year-old. I wish I knew it 6 years before that to be able to do some sort of work with them. And so therefore any professional who is working with the child, any professional, that could be the doctor, that could be the preschool teacher, they have to be honest in their observation, and they have to be honest in conveying the same to the parents without being scared, without being being scared by the management as well. It shouldn't be that the management says, oh, this is not our job, let the parents find it by themselves. No, it doesn't work like that. You are a school. If you are a teacher, you are responsible for every child. And therefore, the parents they have the responsibility, but at the same time, they also need to know what needs to be done at the very early stage. And that's where they can work with the child. And that's where that stigma and, the main problems come when the school says, oh, we cannot look after the child, we cannot take care of your child, child needs to go to a special school, or my teachers are not trained, I do not have enough resources. That's where the parents feel let down. And that's where they lose all the confidence to be able to work with their own child. So I guess all the professionals need to be honest when they are dealing with any child for that matter. Yeah, I hope that answers somewhere.
My next question is to Nimrat ma'am. There are a lot of social barriers, social challenges that are faced by children with special needs: isolation, discrimination, and most importantly, it affects their self-esteem. So how can they deal with this aspect on a personal level?
Fantastic. In fact, that's what we were, when we look at that, if the child, in any education system or any home, what is the first thing that we need to really look at? We need to uplift a child's self-esteem. That is why we have education, so that we can identify what the child's strengths and work around the strengths. Okay, but as we see that's quite an uphill task in our society, because there are some emotions or some behavior which is not respected. It is taboo. And here I will go back to the seed. Where is the seed? The plant is only as good as the seed. So if you want, you plant mango seeds, you will get a mango. But if you plant a lemon seed, you're not going to get a mango, is the thing. So if parents, they understand that they have a very critical role. I'm just taking you back to a parent. So imagine that the parent has identified my child as a special child. Now, what does the parent do in this case? If the parent takes some time and, comes out of denial whenever, I think the first thing is to start valuing, accepting, and, energizing oneself, getting more patient. I think patience would be the biggest hallmark that the parent needs to have, so that the child doesn't start, because the mirror, the child's self-esteem is coming from where? From the school, from the peer group, and from the parents. Parents are the strongest support. It's like the roots of the tree. If parents approve of a child and say, beta, whatever it is, I'm happy. You ran the race. You came last. I'm super proud of you. You ran the race. So here, what is our parameter? Self-esteem, not competency. He slowly, as a parent, starts identifying that the child has certain strengths. That's where the true inclusion starts in the house. that we can play games together, we can have fun together, and we can laugh at each other. So the child learns to understand what he can do well, what he can't do well. I think another thing that we can actually look at is, can we have groups like this where, children with similar kind of abilities socialize with each other, as well as socialize with different types of children, if parents can do that. Another thing I feel that, as even just now Mala was talking about, see, assessment becomes a one-time thing. Parents should be very vigilant, very alert, and very accepting of the fact that we need to keep having these time-to-time assessments so that we know how the child is doing. And trust me, I have seen over a period of time, the parents who are very religiously, interested in their child's overall growth, and they are not looking at the child outside in. आउटसाइड इज दुनिया क्या बोलेगी, अच्छा लगेगा कि नहीं, ये तो स्टिग्मा है, ये नहीं बात करनी चाहिए बच्चे को. दे डोंट टेक देयर चिल्ड्रन आउट टू डिफरेंट प्लेसेस. इन्हें अच्छा नहीं लगेगा, किसको अच्छा नहीं लगेगा. I have friends who have autistic children. They're so super proud of them. They said, no, our child doesn't come there. My child won't be comfortable. वो बच्चा गंदा करेगा. Are you okay with it? My child will move around every place. Are you okay with it? So it's up to the host if they want to entertain you or not. They're not bothered. So I think if this thing comes into a parent that my child is my universe, it's perfectly fine. I am ready to accept the child, given his limitations, given whatever he is. He also has a lot of strengths. I think if our thing changes, our understanding of our child becomes more child-centric than system-centric. System is expecting something, but the child has some other needs. If that gets understood, I think even schools will have to pull up their socks, because parents will also be asking them a lot of questions. Today, very honestly, I've seen parents putting their children in schools where, it's an IB school or IGCSE school. They say, usme performance important nahi hai. Is that a way of running away? You think the school is still not responsible for what the child should be learning? So I think it's like a chicken and egg story. The schools also have their role, and parents also have to play a very important role in creating this, upholding the self-esteem. Self-esteem khatam hui, sab kuch khatam ho gaya. We are not worried about how well he does. The child will find his ways for sure. I've seen a lot of children becoming musicians, becoming very good at hands-on work. They're very good with electric things, things which gadgets. So where is the problem? I think the problem lies in us as human beings. We have a limitation in understanding us. I think that was very beautifully depicted even in Tare Zameen Par.
And Jayati, at this juncture, I will definitely like to add that at Pearl, we are blessed to have parents who are so assertive, like Nimrat ji said. Parents need to take the lead, and those parents have become change makers. We have quite a few handful of parents, who have introduced themselves or their child to the neighbor, to their relatives, and they make it a point that they take their child outside. This institute, Pearl as an institute, has also promoted that, but parents also has, holded hand with us and taken that, and they have been such amazing change makers that today the self-esteem of the child, or the confidence of the child, the way, वो reverse किया है, because it was very difficult to get into the mainstream system. So कान ऐसे नहीं तो ऐसे पकड़ने पड़ेंगे. But today we can see that there are so many ample of individuals, your neurodiverse, who are so comfortably going out for movies. They are moving in the society. They are having a night out. They are having their birthday parties, and with super comfort and confidence. So yes, parents can do amazing.
And I want to add something, Riva ji, because I had been to your institute on that special day when parents were invited to, and you all showcase what the children have done, yes, what they've accomplished. Yeah. And the pride you see in the parents is extraordinary. It moves and touches you. And that day you feel mission accomplished. Even if we could help a few children like this. Yeah. That the children have made the parents proud of, that. So I love that. So I really wanted to acknowledge it. Thank you for creating such spaces in Ahmedabad, genuinely children are loved, appreciated, and respected so that they can grow the way they want to grow.
Thank you, Nimratji, for your acknowledgement. Thank you.
So much, everyone, for being here. Looking at the time, I think we will wrap up now. Before parting, are there any words or anything that our speakers would want to share today?
I think there's a question that is unanswered.
I'm so sorry. I think my internet went unstable.
Oh, okay. So would you want me to read for you? Can you read it?
I'll go ahead with it. When trying to keep inclusive environment in the class, many times other parents come with concern that repeating instruction, giving extra time for a particular child, or making buddy pair make the class learning slow. So how do we deal with that? Mala ma'am, do you want to go ahead with this question?
Right, okay. I think with the whole education system, the conventional way of teaching in the classroom has completely changed during these COVID times. So we have seen now how, being in that physical classroom has changed to be online and having 15 or 30 odd children in one classroom. So definitely things have changed. And so where the parents think that, oh, it's going slow or it's going fast, or my child is actually behind because of that one particular child getting all the attention, I don't think that stands anymore. Because that's where the teacher's planning come in place. I as a teacher should know that my lesson is for 50 minutes. So 5 minutes I spend in introducing the lesson, 20 minutes is my group activity, 10 minutes is my independent activity, and 5 minutes at the end would be my plenary. And here, how do I differentiate my lesson to cater to that one child in the classroom, and so the others can cope up or be at the same pace? Now here, what lies is the teacher's capability to be able to plan properly their lesson, knowing that the child is there and how to cope with their abilities of that child. Putting a peer buddy system in the class, putting peer assessment in the class, that really helps. That helps all the children. And with coming off for UDL, the Universal Design for Learning, that is something where the schools will have to put all the efforts, that how putting a video of 5 minutes will help all the children to learn. So there are parents who feel that my child is not benefiting, but at the same time the child is learning all other aspect, the social aspect of accepting differences, accepting different opinions in the classroom, and seeing somebody who is different, and how in the society this will impact that particular child. So we are not looking at only what learning takes place in the class. That in one lesson, if the 5 minutes are given extra to one child, that won't really make a difference to the overall learning of the other children. And the same way, I had this question earlier in one of the webinars, that if the school start providing laptops to that one child in the classroom, so it's unfair to the other children. But then that's where the sensitization comes in. That's where the parents needs to be sensitized that why these provisions will be put in place. How would this one measure will help that child to come at par with the other children? So, in an inclusive setup, in the mainstream schools, the teachers, that's why the teachers have to be sensitized that, they don't have to now sit with that one particular child to make sure that that child learns. That child may not be even at the level of the other children. So how would that worksheet will be differentiated to meet the needs of that child?
Thank you so much, ma'am. I think that is the time that we have today. And I will be sharing the screen with all the details of our speakers, so you can reach out to them via email and they'll be really happy to answer that. I would just like to thank all our speakers today for taking their time out and honestly opening a lot of eyes today in terms of understanding prejudice, in understanding the planning method for teachers, and also giving a lot of personal examples and anecdotes. I think that experiential learning was also the key of today's webinar. And I also encourage, if anyone wants to talk about something and if they would want to unmute and give us a feedback, that is also completely fine.
I want to say something. This is really, lovely. The way it was so spot on with the right kind of examples. And I think you all are doing amazing work, because the way, I loved where this was going. It was very sensitively handled. And I'm very sure that we are in very good hands, because if this is how, we keep working relentlessly, because our bachas are universe, and we don't compromise on that, we can see the real results then. So thank you so much for this, and Jayati, you moderated it beautifully well. Thank you.
Yeah. Thank you so much. Thank you.
I'm sharing the screen right now, and you can get all the details here. And thank you so much for the participants as well for their active questions. And I think that also created the learning process much more exciting.